Imagine a symphony orchestra, but instead of instruments, each musician plays a vital role in maintaining the balance of fluids and electrolytes in your body. This orchestra is none other than your kidneys, and the musicians, the different parts of the nephron, the functional unit of the kidney. Today we dive into the world of diuretics, drugs that orchestrate the rhythm of this symphony. Diuretics in essence are medications that increase the amount of water and salt expelled from the body as urine. They do this by acting on different parts of the nephron, each with its unique role in this intricate composition. Picture the nephron as a winding river, starting with the glomerulus, the site of filtration. Here, water and solutes, including sodium, are filtered from the blood into the Bowman's capsule. This fluid then flows into the proximal convoluted tubule, or PCT, where about 2/3 of the sodium and water are reabsorbed back into the bloodstream. Next, the fluid journeys down the loop of Henle, a structure that dips into the medulla of the kidney. Its descending limb allows water to flow out, while the ascending limb pushes out sodium. The distal convoluted tubule, or DCT, follows, where more sodium is reabsorbed. Finally, the fluid reaches the collecting tubule, where the fine-tuning of water and sodium reabsorption occurs. Now onto the main act, the diuretics. They are classified based on their site of action within this river-like nephron. First, we have the thiazide and related compounds such as hydrochlorothiazide, metalazone, indapamide, and chlorthalidone. These conduct their symphony in the DCT, inhibiting sodium reabsorption and thereby increasing water excretion. Next, the loop diuretics like furosemide, bumetanide, torsemide, and ethacrynic acid. These maestros act on the ascending limb of the loop of Henle, inhibiting the reabsorption of sodium and chloride, which leads to an increase in urine output. Then we have the potassium-sparing diuretics, including spironolactone, iplerenone, amiloride, and triamterene. They perform their magic in the collecting tubule, blocking sodium reabsorption and helping to conserve potassium. Carbonic anhydrous inhibitors like acetazolamide, dichlorphenamide, methazolamide, and dorzolamide primarily act on the PCT, reducing the reabsorption of bicarbonate, thus increasing the excretion of sodium and water. Moving on to osmotic diuretics, substances like mannitol, glycerin, isosorbide, and urea, they work in the PCT and the descending limb of the loop of Henle, pulling water into the urine. Lastly, we have the organic nitrates and xanthines like nitroglycerin, isosorbide dinitrate, theophylline, and caffeine. They act by dilating blood vessels and increasing glomerular filtration rate. Like every medication, diuretics also come with their own set of side effects. It's important to understand these, as well as their clinical uses, to make informed decisions about their use. Let's take a closer look at some of the key players. First up, the thiazide. While they're brilliant at what they do, they can also cause hyperkalemia, hypercalcemia, and hyperglycemia. Despite these side effects, they're commonly used in treating hypertension and edema, shedding excess water and salt from the body. Next, we have the loop diuretics. They're powerful, but they can cause hyperkalemia, dehydration, and in rare cases, ototoxicity. However, their potency makes them ideal for use in heart failure, renal failure, and edema. Then, the potassium-sparing diuretics. They're unique in that they help conserve potassium, but they can also cause hyperkalemia and metabolic acidosis. These diuretics are commonly used in heart failure and hyperkalemia. Each of these diuretics has its own unique composition and plays a different instrument in Kidney Symphony. Understanding their side effects and clinical uses can help in making informed decisions about their use. In our next scene, we'll explore the counter-melody of this symphony, the antidiuretics. Stay tuned. If you found this video helpful, please like, share, comment, and don't forget to subscribe for more informative content. Scene 5. The Counter-Melody of Antidiuretics. So what's a symphony without its counter-melody? Q. The antidiuretics. Compounds such as vasopressin and desmopressin lower urine production, thereby offering a balance to the diuretics' effects. Scene 6. The Harmony of Diuretics. The realm of diuretics is genuinely enthralling, and grasping their mode of operation is vital. Each category of diuretics assumes a distinctive part, functioning at diverse locations of the nephron, steering the concert of fluid and electrolyte equilibrium in our organisms. The utilization of these, taking into account their adverse impacts and clinical applications, is the secret to balanced health supervision. Thus, when diuretics cross your mind next time, envision the symphony of your kidneys, every nephron component performing its exclusive melody under the leadership of these extraordinary medications.